Hello everybody, today inshallah I will talk about the effectiveness of mulligan mobilization, which was one of the commonly technique that used to treat mechanical neck pain. The neck pain in the absence of radiculopathy or myelopathy or a clear serious disease is also called mechanical neck pain. This type of pain may be labeled as cervical muscle strain, myofascial pain, cervical facet joint, and dysogenic pain. Mechanical neck pain commonly occur in multifactorial origin that include one or more of the following, like poor posture, anxiety, depression, sporting or occupational activity. So the neck pain in general classified as four group, with grade 1 the mild sign and symptom, and the most severe one grade 4. As I say, grade 1 neck pain with no sign of major disease and no or little interference with daily activity. Grade 2 neck pain with no sign of major disease but interference with daily activity. Grade 3 neck pain but now with a neurological sign of nerve compression. And grade 4 neck pain with the sign of major disease. So the mulligan mobilization is the concurrent application of sustained accessory mobilization applied by therapist and active physiological movement and the end of the range by the patient. In the passive end of the range, we use overpressure or stretching. We have more evidence that talk about the effectiveness of mulligan technique. One of these evidence, this article that talk about the effectiveness of mulligan mobilization technique in mechanical neck pain. The aim of this article to investigate the effectiveness of mulligan mobilization in participants with mechanical neck pain. So I will talk about this article in summary, and then we conclude this article at all. So this study was a randomized controlled trial. They divided patient equally into two groups, Group A and Group B. The total participant, 40 participants, 35 female and 5 male. The age range between 25 to 50 years old, and treated patient to 10 times. As I say, we have two groups, Group A, mulligan mobilization group, and Group B, the control group. The participants divided equally. The mulligan mobilization the Group A take mulligan mobilization technique with home exercise program, and control group take home exercise program only to show the effectiveness of mulligan mobilization. Both groups treated for 10 sessions performed on 5 days per a week for 2 weeks. So they use several parameters for neck pain. I will talk about some of this measurement and talk about it in details. For pain, they use visual analog scale. For muscle strength, they use stabilizer, pressure biofeedback, and handheld dynamometer. For range of motion, they use goniometer. For pain threshold, they use algometer. For disability level, they use neck disability index. For quality of life, they use Nottingham health profile. And for depressive symptom, they use peak depressive inventory. And the last one, for the cervical performance level, they use cervical performance test. So the first measurement for cervical range of motion, they use goniometer. In all direction, they take the measurement for 3 times, then they take the average and record it. For muscle strength, they use two parameters. The first one, stabilizer pressure biofeedback, and the second one, hand-heel dynamometer. The measurement was repeated 2 times in both directions, then take the average and will record it. Now I will show you these devices. This is the biofeedback device. In a neutral position, we take the biofeedback and place it under the neck, as we see in this video. Also, the neck should in a neutral position. The biofeedback was motor control training of the deep neck flexor muscle with the pressure. Biofeedback can improve pain and disability in patients with neck pain. This is about all of the thing about biofeedback. Now the second device was a hand-heel dynamometer. For example, when we measure the flexion, cervical flexion, put patient head and neck forward position, as we see in this video. Then brace start on the active force up and push up from 5 to 6 seconds. And I will repeat this process in all movement, like extension, but the same movement and the same thing we do it, but in the extension movement and head backward. Then repeated measurement for 2 times, and the average of measurement were recorded. The second measurement for severity of pain, we use visual analog scale. Visual analog scale with 0 no pain, and 5 moderate pain, and 10 severe pain. Now for pain threshold, we use algometer. Algometer was applied to measure occipital frontal circumference, paravertebral and spinal process, the circumference of the back and the scapula. The algometer probe was placed perpendicular to the skin, and then the participant was asked to mention the time when she or he first would feel pain after starting the application of a pressure. Also, we take the measurement 3 times and repeated. The average of measurement was recorded. This is the algometer device. The second parameter for disability level was neck disability index. This index consists of 10 items referred in various factors such as pain intensity, work, driving, sleeping, and so on. Each of 10 items score from 0 to 5, with 0 the best situation and 5 worst situation. The total score range from 0 to 15, indicating 0 no disability and 15 severe or complete disability. This is the classification of disability. From 0 to 4 no disability, from 5 to 40 mild disability, from 15 to 24 moderate disability, from 25 to 34 severe disability, and from 35 or over complete disability. So now we will talk about the intervention. Mulligan mobilization group, as I say, 3 set, each set 10 time repetition, interval between the set from 15 to 20 seconds. We have two type of mobilization. The first one, self-mobilization technique, also called snag. The second one, neutral apophyseal glide, also called nag. Now I will show the video about snag and nag. We can use strap or belt for now. For example, we need for flexor cervical muscle, we do flexion and tuck and keep sustain glide in spinous process of C2 for 3 seconds. Now we see in this video the process. In C2, he put the belts in cervical and flexion for the tuck. We repeat this process and do the same thing in the extension, but move the head forward into anterior direction on spinous process and for 3 seconds, and repeated movement 2 to 3 times. This is for extension extension movement. And the same thing in all movement. This is about snag. Now about nag. So this is all of the thing about the nag. Usually snag applied by the patient and nag applied by the therapist. So as I say, in the both group A and group B, either mulligan group or control group, we applied home exercise. Home exercise program for 3 sets, 5 days of the week, for 2 weeks. The first exercise, range of motion exercise for all movement, either neck flexion, extension, right, left, lateral flexion for 15 to 20 repetition. The second exercise was stretching exercise for upper trapezius. As we see in this figure, we gently pull your head to the side on your ear, approaches the opposite of the shoulder, and switch the side. We do this exercise for 3 times a day with 10 repetition. Hold in this position for 10 to 15 seconds, then relax and do it for 3 to 4 times. The third exercise was stretching exercise for posterior part of the deltoid. Start with the crossover arm stretch. Relax your shoulder, pulling them back so that your shoulder fall along either side your spine. Reach one arm across your body and grab it at the upper arm with your other hand. Gently pull it as full across your chest as possible until you feel a stretch at the back. When you feel stretch at the back of your shoulder, hold for 30 seconds, then relax 30 seconds. Repeat this movement, then stretch in the other arm. The fourth exercise, stretching exercise for pectoral muscle. Doorway pectoral stretch. With the help of doorway, you can easily stretch your pectoral muscle. Stand in mild of doorway with one of foot in the front and the other in the back. Bend your elbow at 90-degree angle and place your forearm on each side of the doorway. Shift your weight into your front leg, leaning forward until you feel stretch in your chest muscle. When you feel in chest muscle stretch, hold for 15 to 30 seconds, then relax, then return to starting position and repeated this exercise for 2 to 3 times. So, as a conclusion, we can say the mulligan mobilization technique is effectiveness technique that treatment manual neck pain, such as increase range of motion of joint, reducing pain and increasing muscle strength, and decrease disability at all. So we can say the mulligan mobilization technique can help to treat neck pain in all patients and return or increase quality of life for the patient. That's all of the thing about mechanical neck pain, and thank you.